Hello and welcome. Today we'll talk about advances in organ transplantation. So, what is organ transplantation? Well, organ transplantation is basically a medical procedure when the organ is removed from a body and placed into a body recipient to place a damaged or missing organ. There are a lot of organs that can be transplanted, such as livers, lungs, and pancreas. Tissues can also be transplanted, like bones and skin. But before we start explaining what the advantage of it is, it's very important to understand this. Organ donation is when a person donates their organs, either through their own consent or through their family member's consent, if they're dead. Organ transplantation is the process of moving the organ to the donor's body, the person donating the organ, to the person in need of the organs. Now, there are two types of organ donation. One, living donation. Living donation includes organs such as the kidney and liver, and caloric donation includes organs such as the liver, lungs, cornea, which is a part of the eye, and other organs like that. So, how does organ transplantation work? Well, first to identify recipients. You have to find the person who is in need of organ on the waiting list in the hospital. Then you have to find a donor. Find a living or dead person who agrees to donate the organs. Then you have to evaluate the organ, see if the organ is alright for transplantation. If it's, if it's not alright, then it can't be used. Then is the surgical procedure, which the organ is removed from the donor and transported to the hospital the recipient is residing in, and it has to be carefully preserved, or else it will go bad and we can't use it for the transplantation. Then we do the actual transplantation, and then it's the post-transplant, where the recipient will be watched closely for signs of rejection and other complications of surgery. Now, what organs or tissues can be donated? Overall, there are nine. Some of the organs are here, and you can read them yourself. Now, I'll talk about some of the key milestones in organ transplant. In the 16th century, there was an Italian surgeon called Gasparo Tagliacozzi who managed to reconstruct noses and ears using skin from patients' arms. And he now found that skin from a nose donor usually called transplant to fail. And that would be now called transplant rejection. In early 16,000s, European doctors tried to save patients' lives by transplanting kidneys from various animals, such as monkeys, pigs, and goats. However, none of the patients lived more than a few days. Now, this is important. In 1905, the first ever organ transplant happened, which was done by Eduard Zirm, which I'll explain later, who was an Austrian ophthalmologist, and performed the world's first corneal transplant, who has restored the sight of the man. Again, I'll talk about this later. In 1936, a Ukrainian doctor called Yuri Wormy transplanted their first human kidney using an organ from a deceased donor. However, the recipient died shortly because of transplant rejection. In 1954, the first human successful kidney transplant happened in 1954, where a surgeon transplanted a kidney from 23-year-old Ronald Henrik into his twin brother Richard. And since both the donor and the recipient was genetically identical, the procedure managed to succeed. In 1960, British immunologist Peter Bedwar, who had studied immunosuppression roles in transplant failures, managed to receive a Nobel Prize in his discovery of acquired immune tolerance. Then, soon after his discovery, anti-rejection drugs allowed a patient to receive organs from a non-identical donor, so not genetically identical, as we see from 1954. In 1965, a kidney transplant in the UK uses an organ donated from a dead person for the first time. In 1967, the world's first heart transplant was performed in South Africa from a surgeon called Dr. Christian Barnard. He managed to replace the diseased heart of a dentist with that of a young accidental victim. Even though immune suppression drugs prevented organ rejection, The recipient died of pneumonia 18 days later. However, it proved that a transplant was possible. In 1968, Britain's first heart transplant was carried out by a team of 18 doctors and nurses. When the patient, Frederick West, received a heart from labourer Patrick Ryan, who died of head injuries. Also in the same year, Professor Roy Kane performs the UK's first liver transplant. In 1971, the donor card for kidney donation is introduced to show a person who wishes to donate the organs whether they die or not. In 1984, as the organs became less risky and more prevalent, the US Congress managed to pass the National Organ Transplant Act to monitor ethical issues and address the country's organ shortage. Established a centralized registry for organ matching and placement while outlawing the sale of illegal human organs. In 1995, the UK's first living liver donation takes place, and the first living lung lobe transplant for a cystic fibrosis also takes place. And finally, in 2010, Spanish doctors conducted the world's first full face transplant on a man who was injured in a shooting accident. In and here is the first organ transplantation. In the 19th century, corneal transplantation was nearly not successful. However, in 1905, Zirm, who shall talk about later, encountered a patient called Alois Glojar, who was a 45-year-old farm laborer whose eyes had turned white-gray and opaque year earlier when working on the farm. Around the same time, a 11-year-old boy called Karl Bronner was brought to Zirm's clinic with a penetrating eye injury with eyes in metal foreign bodies that unfortunately lodged in his eyes. When the attempts to save his eyes were unsuccessful, Zirm, with the boy's father's permission of course, removed them and used the corneas for transplant into glue gauze. Although the complications during the transplantation affected one eye, the other eye became clear, allowing Glodar to work again. The operation was and the healing process was very complex. At that time, there wasn't a lot of modern technology, a microscope, or microscopic instruments. However, nowadays, the Zerm's method still remains the basis for repairing corneal damage. In and now we talk about Eduard Zirm, the doctor behind the first successful organ transplant. Eduard Zirm was an Austrian ophthalmologist, which is basically means an eye doctor, that lived between 18 March 1863 to 15 March 1944. Zirm was born in Vienna and lived there for most of his life. He also studied medicine at the University of Vienna and ophthalmology at the eye clinic there. After his graduation, Zirm became an eye doctor at the second eye clinic in Vienna, and soon accepted a position at a hospital there. It was there that he became chief of a new ophthalmology clinic, which he also helped establish. There in the clinic was where the first organ transplant happened. In his spare time, Zirm played the violin and studied natural philosophy. He published a book in 1937 which discussed ideas such as emotional intelligence for the first time. He also wrote many poems and stories. He ultimately died in 1944 in Homeric, nine, in, 19, in Protectorate of Bohemia and Bulgaria. The success rate of organ transplantation has massively increased as time goes on as as now over 80 to 90% of patients who have undergone organ transplantation survive. Organ transplantation has also saved numerous lives, as people who receive them live much longer than people who haven't. The main reason why people have died after receiving organ transplantation is because of graft infection, failure, or infection. Now, the ethics of it. Well, first of all, there's religious and cultural beliefs that can be a bit of a ethical issue in organ transplantation. Some religions may have beliefs against organ donation, and it's essential to respect the opinions, whether if you believe they're correct or not. The existence of living donors are also an issue. When they donate the organ, they face several health risks, and is debatable, or and to morally ask whether someone can risk their health for the benefit of another. And finally, the most significant one, in my opinion, is that there's always a limited supply of organs and a high demand for them. So there just isn't enough for everybody. However, the most important part is that we respect the wishes of the people, even though if we disagree with them. Here's a video I made on conclusion. Overall, the advances in organ transplantation has been amazing. We managed to save millions of lives, and it's important to learn about the advances so that we can improve even more, save even more lives. From the very start in 1905 to right now in 2023, we've accomplished so much, and it's important that we continue saving lives through donating organs and transplanting them. And now, here are the citations which we used to find our sources. Thank you for watching.